the people that go, oh, it's this, but you tell it in such good sound form because you live this life. I mean, you're in
Yeah.
contact with everybody
Yeah.
who could have it. So I thank you for your advice on this. I mean,
And I would
Yeah.
like to welcome our guest. We have
Just the
Dr. Rahul
principle. Yeah.
it is
joining us
principle.
from.
Yeah.
So
Just
we
the
have Dr.
principle
Bahot.
is you have
Go ahead.
just the just the principle is you have to clean and wash your virus. It is not my virus. It is not your virus. I have to
Yes.
clean and wash your virus as well as my virus.
That's right.
Okay.
That's right.
So Dr. Rahul, we have Dr. Rahul with us. He's a consultant pulmonologist at Jaslok Hospital, Bombay. And Dr. Rahul, we
And
have
Dr.
Dr.
Rahul,
Pediatric surgeon from Delhi.
Namaste.
We have Rajkumar Jaindi. He's a senior chartered accountant based out of Bombay. We have Grandmaster Max joining us from Vietnam. He's originally from Australia,
Sure.
and we have Lee and me joining
Hi Rajkumar ji.
and taking care of the things.
Namaskar.
Namaskar.
Namaskar, sir.
So, Dr. Rahul, as Dr. Sabu
Good
said,
evening.
there are a lot of best practices and a lot of things we are following as a doctor. What kind of practice you are following for your family?
Can you come again, sir? Your voice is echoing.
So, I said, what kind of
What
best
kind of practice am I following?
Can you hear us now?
See, yes, I can hear you now, right?
Yeah.
See, we are following a best practice of rationing ourselves first. Because if we consultants, we medical practitioners all go to the field on the front line, there's a, however careful we are, right? There's a high probability of any one of us catching the virus and falling ill.
Yeah.
So we are doing in our practice rationing of ourselves, like one person takes around for a week, and then
Okay.
that person is off for 4 weeks of the campus. Now,
Okay.
having rationed ourselves, we have rationed our residents also in the same fashion. Now, coming to the actual thing, when we travel in our cars, we do not switch on our ACs, but we take the windows down. The reason for this is very simple. The AC in the car, if you see, after some time, the air inside it circulates within itself. Either you take a fresh air from outside or you let the air windows down. As soon as you enter the campus, you are screened and you are checked. We are checked, all of us, by the thermal gun, and our swabs are checked. So deposited, you change into the scrubs, and then we go over hand wash. And hand wash is a surgical hand wash, and you wear the PPE, and then you are out in the thing. We see, we are chest physicians, so we always deal with something like cold, cough, fever, right? So it is as a part of a routine protocol, we wear PPEs all throughout our while we are staying in the hospital. When you come out, you undress your PPE, do your hand wash, remove your shoe covers, which is most important, right? And then wear your other pair of shoes and come out of the hospital and follow the same routine. Before entering the house, do a thorough hand wash. My sister stands with a sterilizing agent at the door, and I'm not allowed to enter the house before doing a proper hand wash. And the
And
shoes are always kept outside the house.
what about the clothing and attire you wear while you were in hospital and while you come back? I mean,
In a hospital today I'm wearing a suit, but in hospital I will normally wear a half sleeve shirt and no ties and a comfortable formal wear, because the ties and the suits are the least washable things which we wash very quite less, and they have a chance of carrying the virus more commonly than whatever we can. And we also don't use our own personal stethoscopes and own personal writing instruments. We use whatever is provided in the hospital, and the hospital equipment does not come home, and our home equipment does not go to the hospital. So
and sir, do you have separate clothing for hospitals and for your
yes,
home?
yes. We have to change it to scrubs when you go into the hospital, and then you are allowed inside the campus.
Okay. And are you following any kind of sanitization, I mean, gate kind of a thing? Because your cars, your mobile phones, everything is contagious to
Yeah,
virus.
so in the hospital, our mobiles are all kept in the locker as in department. We don't take mobile phones within the hospital itself.
Wow.
And see, however careful you are, whatever sterilizing agent you use, right? It's very difficult for us to achieve 100% sterilization at all points. So it's best to
So
avoid use of mobile phones. And whatever is there, you can see there are always phones in the hospital. They can reach you
yeah.
at whatever extension you are there on the hospital, and they're also covered by a protective plastic drape, which is sterile.
Okay. I'm getting a lot of requests from our viewers that they would like to know more about you. So they wanted to know where are you from, what do you do, how you have started your journey as a doctor. So can you please
See,
elaborate?
Yeah,
Yeah.
your personal background. What in particular this particular practice.
Yeah.
Yeah. My name is Dr. Rahul Bahot. I'm a citizen of Mumbai, India, and I'm practicing at Jaslok Hospital as a full timer and as a teacher at there, training the residents there. Right. So this is the brief background about me. I take sessions and lectures for the postgraduate. I also I'm a CME certified speaker by the Medical Council, where I take CME sessions for the other doctors. I have young onset Parkinson's, but that has not deterred me to move in life. And I do my bronchoscopies without any hurdles, and life is just good.
Life is just good.
Great.
Wow, that's awesome. I want to ask a question. Doing what you do, because mostly it's lung cancer patients. Am I correct?
See, I'm a pulmonologist. I look after chest diseases.
Chest diseases in general.
That is your asthma, COPD, smoking diseases, lung fibrosis, tuberculosis, pleural diseases.
Asthma
Also,
and things like that. So I'm just
yes,
curious, with the COVID-19, do you
yes.
see that there are going to be permanent damages to the lungs because COVID was in there? Because we know that it tears. Is there going to be
See,
permanent damage?
Coming to your first point, COVID-19 causing permanent damage to the lungs. Most of the times, the disease is a mild course of a disease. 82% of the patients do not manifest with severe pneumonia or any signs as such. They do manifest, but they manifest like a mild infection, mild fever, dry cough, and it subsides on its own. The kind of patients which we are really worried are the patients which have decreased lung compliance, as in the chronic obstructive pulmonary disease, where the disease can take a complicated course. But again, if you see the world statistics for complicated courses, it's not much. More or less, if you take proper precautions in an early phase of the disease can be halted, and you can definitely win over this virus, provided you follow the social norms, obey your government authorities, and take a good care of yourself.
That's good. Yeah, that is awesome.
And
That's
sir, what are the basic symptoms of COVID-19? Because we have seen symptoms starting from January. There were some symptoms, and then we are adding a lot of new symptoms now, and people are a little confused and scared. What are the symptoms, and how they would get to know whether they have COVID-19?
Aniket, the first and the foremost thing, COVID does not present like a simple flu. A flu has an incubation period of 3 to 5 days, right? Flu will start as rhinitis, runny nose, throat congestion, and then fever comes. COVID has a more subtle onset. Subtle onset in the sense that you will have fever coming as a predominant complaint first, then cough will come as a second complaint over 3 to 4 days. Then gradually, if the disease goes in a complicated phase, you will have breathlessness setting in, right? So when you find your fever and cough and no rhinorrhea, that is no runny nose, you have to suspect yourself, or you have had a contact with somebody who has traveled from outside. We see a lot of people who have come from outside. So it's better to screen yourself first, get your COVID test done, meet your doctor, ask him that you expose your history, that you have met somebody from outside the country, and get your testing done. These are the simple ways to do it. But lately we have found COVID is not a respiratory disease alone. It presents a multi-system disorder. It can present as a renal failure on day one, proteinuria, severe proteinuria on day one. It can present with a CNS complaint like cerebrovascular accidents. It can present to ophthalmology like conjunctivitis, runny, watery eyes. It can present to cardiologists with chest pain, acute coronary syndrome. So the suspicion of COVID is to be high on our cards and index, right? If we find a history of foreign travel or a history of fever coming in first, and these complaints coming in, we should have a high index of suspicion. That is only we have presently in hand. But there are some tests which can pick up COVID very early, like if you do a screening CT scan of the chest. Mind you, screening CT scan is not available everywhere, but where facilities are available, screening CT scan can show you some changes on the lungs fields which even appear before your saturation drops, or your X-ray picks up a finding, or your RT-PCR comes positive. The rate of positive CT scan picking up the COVID virus or a viral infection is 72% in RT-PCR, that is swab negative individual, which is a high number.
Yeah.
So it is must as a chest physician that I screen my patients. Mind you, screening CT scan does not take a long time like a usual CT scan. In my centers, a usual CT scan only takes 6 seconds for a patient to be screened.
Okay.
Yes, sir.
And what are the best ways to treat symptoms? I mean, if we have some initial symptoms and we think it's going toward the COVID-19, because symptoms
See,
can be something 14. So
yeah.
what are the
So,
treat?
so my request to all the viewers is do not self-medicate. Number one, do not self-medicate.
Okay.
Ibuprofen is contraindicated in COVID. Please do not take ibuprofen. Right? A simple paracetamol can do your job. Fine.
Yeah.
Follow doctor's instruction. Having no respiratory compromise, saturations are good, respiratory rate is good, there's no florid pneumonia. This patient can stay at home under isolation. Now, when I say isolation, it's a strict isolation which has to be followed. Means the utensils, the dressing, the attached toilet of the patient should be separate. Because this virus is even found in the excreta of a human and even in the saliva of a human being. Fine. So when you maintain a good separation and give a good hydration, put the mask N95 on the patient's face, sir, please. And the caregiver has to use that N95 mask and follow proper universal safety precautions. That is only which is required. Now, coming to the point, why get the virus itself in the first place? Why not follow social distancing and protect yourself with good hygienic practices and keep the virus away out of your door?
Oh, I
They
agree.
say apple a day keeps the doctor away. I say hand wash a day and social distancing keeps the COVID virus away.
That's a way. Okay.
Lots of water.
Yeah.
Drink lots of water. You know.
Yes, ma'am.
How
They
big is
advocate
the
to drink
impact,
water, but lots of water is not recommended as much as it is. It's a common thing, which but the studies have found out no great benefit of drinking a lot of water to
Okay.
also. And the water you drink is very important, ma'am, because it has to be boiled, filtered, and then cooled. Most of the people do what they do, they keep it in the refrigerator and then they drink a boiled, cooled, chilled water, and then they catch a normal flu and they say, oh, it didn't work. That's it.
They did it wrong.
Yeah.
Boiled
Doctor, there is one more,
So nowadays
yes.
we have special waters as well. I mean, sports people used to have. I think Max is with us. He is a grandmaster chess. So what they do is they have hydrogen-based water, which is good for health. What do you think about that water comparison to the aqua water, filtered water, or maybe we use the matka water in India? What are the different ways to capture those water, and what are the good? I mean, is it good for body or immunity? Yes,
I don't-
Dr. Rahul.
Sorry, can you repeat the question?
Just repeat the question. Yeah.
So I've asked a question to Dr. Rahul that sports people who have a lot of athlete-based sports, like maybe they're playing football or tennis or all those things, so they prefer hydrogen-based water, which is good for health. I'm not sure whether the chest is also following the same thing. So just I wanted to understand how that water is different from the filtered water what we have. And in India, we used to have water which we put it in a mud kind of a basket, and that is an auto chill water which gives you a lot of immunity booster. That's what we believe in India. So just wanted to understand, which is the good water to have it at this point of time. Dr. Rahul?
Yeah, can I come in, sir? See,
Yeah.
we come from a background where our resources are scarce, right?
Yeah.
A good water boiled at 100 degrees and then cooled, filtered and cooled is a good water for me to use anywhere, right? With the bottled water, which you say, there's always a risk of contamination, as we have seen various reports cropping up in media and anywhere. I would strongly recommend against the use of bottled water because I don't know how long the bottle has been kept, or you have to check the manufactured date, which I don't think so. Even I don't check a manufacturing date of the bottle before consuming it. So I would prefer a home filtered, boiled and a cooled water that is best to keep me and my patient safe.
Okay.
Doctor, the viewers like to know one view about this COVID-19, where you as being a specialist in the pulmonologist for the respiratory, because normally what we understand is the moment if the COVID is become positive in any patient, then the respiratory problem is there.
No.
How to deal about that? How to deal about
Sir.
that?
See,
And
sir.
how we can come to know the symptoms are there?
Okay, sir. I'll answer your question in parts. First thing, as soon as the patient is detected COVID positive, does not mean the respiratory symptoms set in. Because
Right.
82% of the times the virus remains indolent. It follows a mild phase. Now there are two variants of the virus, L variant and the S variant. If you have the S variant of the virus, which is picked up on a genome study, the course is mild. The course is not so fulminant. But if you have the L variant of the virus picking up, then the course is fulminant. Now, number two, the
Sir,
individual's own immunity.
can you elaborate this S basis and L basis of virus? Because till
See,
date we know only it is a positive or negative as a layman.
yeah. As a layman, see, you'd say a positive or a negative, but let me tell you something more interesting fact which we have come across. The sputum test, the nasal swab test which we do, only 66% sensitive, right? That means out of 100, 34 people will have the virus and will not be tested positive. This is the limitation of the test. Whereas in salivary samples, 91% sensitivity is there. And when we add a screening CT to the test, the sensitivity of the screening CT in positive patients is as close to 95%, and in negative cases, as close to 75%. So you increase the diagnostic yield of yourself. That is the number one for diagnosis. Number two of your question is, how will the patient know? Right? How do I know that I am having COVID? If the disease, the underlying disease, suppose I have asthma and my disease exacerbates and it's not resolving by usual medications which I'm taking, which for control of asthma, I should get in touch with a practitioner or my doctor and ask him to screen me for COVID, because screening and having a high index of suspicion is primarily important in this disease. First thing, your usual medicines will not work. Second thing, you will have breathlessness. That is the point of time you need to seek an active medical advice. Yes, sir. Have I answered your question, Dr. Mr. Jain?
Yes, sir.
Or
Perfectly, perfectly. Second thing is, Doctor Sir, like that, ki in case, suppose in the surrounding, because lot of lockdown and lot of coordination is there in India, and lot of things are there. Ki suppose in the next door or next building, if somebody got positive, the
yes,
government has, the police has sealed that building. What
yes.
precaution as a resident we can take it nearby area? Whether we should stop going there or we should not come in the contact with the person like that.
See, I would suggest rather than you not coming in contact with the person who is infected with COVID take the responsibility and the onus and act as a good Samaritan to the society and isolate himself in the house. So, this is the primary practice I would recommend rather than, you see, because if you stop going there, if people take this attitude of not interacting with those people, it will mean like a social outcast for that person in the period of lockdown, which is more worse. Instead, the person can undergo self-isolation to himself, wear a mask, N95 mask, or a reusable FFP2 class mask, stay indoors in the house, have an attached toilet to the house. Suppose the attached toilet is not there, then isolate himself in such a way that he goes to the toilet at the time where others are not there using the toilet and cleans the toilet.
Every
And
time.
I'm sorry, but the person should know to clean the toilet. We clean our own toilets in everybody's house, right? We don't wait for somebody else from outside to come and clean. It's better that the person who is infected cleans his own toilet and then follows proper hand hygiene measures, right? It takes a 30-second time. Now, this 30-second time is important, sir. If I have to tell you, if hand hygiene has to be done, it has to be done for 30 seconds, because it has been statistically shown the rate of transmission of influenza virus is 0.01%
Oh, wow.
when you hand wash for 30 seconds. And the rate of transmission increases as your period for hand wash decreases. So, suppose I don't have an alcohol swab. Let me elaborate your question now to a practicality. I don't have an alcohol hand wash. So, what can I do? Use a good amount of soap. That is also sufficient to kill the virus. But a 30-second time is important, sir.
But sir, can
So
we
what
use
I-
Dettol as well with the soap mixing of Dettol? Would that also work?
See, any saponification agent, any agent which saponifies, right? It washes away the lipid, the fat layer of the virus, and destroys the virus surface
Yeah.
protein. So Mixing of Dettol is not necessarily required, sir. A good soap, any soap can do the thing. See, as a practitioner, I have to tell you the basic truths. There's not a
Yeah.
brand of soap which cannot do it. Okay.
I got your point, sir.
So
And sir,
another,
a lot of our viewers would like to know that how they can protect their family members if they think that they have some illness or maybe something related to COVID, because people who are having a headache, they also think that they have COVID. So that is
Yeah.
what the main rumor is. So how
See,
you
I
can
keep
take that?
getting calls from
Yeah,
people saying to me that, sir, I have COVID. Can I be
yeah,
checked? When you ask them the symptoms, they don't match like COVID. The first symptom for COVID is the fever is the most predominant symptom in the absence of runny nose.
yeah.
This is very classical. Like, after seeing so many patients, come to know that this is not COVID. And the kind of cough which they have, COVID patients, is a very dry and hacking cough. You can recognize it from a distance. Having said this, you ask a patient to isolate himself or herself well. Wear N95 mask. Use your proper hand hygiene measure. Now I am again coming to hand hygiene before touching anything, hand hygiene before going to bed, touching your beddings, hand hygiene before eating anything, after eating anything. Please wash your hands. The more you wash the virus off.
Sir, I have a
And
question for Max as well in the meantime,
the
because
family members are not to use the utensils of the patient. The clothes of the patient should be washed separately in a separate solution. Okay, they should not be mixed. Now coming to the survivability of the virus, since you asked this question, right?
yeah,
How much the virus can survive, on what surfaces virus will survive,
Exactly. That's a good
right?
question.
See, the virus is known to survive the least on copper metals. It's known to survive for intermediate period of stainless steel, so up to 4 to 5 hours or more on a stainless steel, and more than 72 hours on a normal surface, right? So mopping of the floor. And one more thing, which is an interesting study from China, which we found, the virus does not remain suspended in air for a long time. It settles on the floor. Okay, so proper mopping of the floor is very important, sir, to cut down the rate of transmission of this virus.
Wow. That's something.
so
Okay, is there a way we could just wash our whole bodies and the inside of our bodies with some kind of solution to get rid of the virus? Because we talk about washing our hands and we do good soap. And is there some kind of soap we can put in our mouth and sinuses and get rid of it? Like,
Madam, honestly speaking, not required. It is taking one thing to an exaggeration point of it. When your hand wash can reduce the transmission virus to 0.01, when you do it properly, why would you want to do something else more tedious? Tell me.
I'm just curious. I think about the virus being inside of me, and I'm like, why can't we just get rid of it?
Yes.
I guess we're waiting
Yeah.
for vaccines, and meanwhile, wash your hands because your hands are the most contagious part of your whole body anyway, right?
Yeah,
Because
right.
we cough, we should be coughing like this, but we cough, we sneeze.
I would not recommend coughing like this, because what happens is when you take your hand like this, instead of your nose touching the arm, your nose goes down and you cough in the air. You
okay.
sneeze out in the air.
So
It has
there,
to be done very properly, right? Instead, use a tissue, disposable tissue, sneeze into a tissue and get rid of it.
that's what I
Right.
have. I do that too.
Yes.
It's easier for me.
one thing
Dr.
has
Rahul,
been
Sneeze
told as far as the sleep is concerned. Just now,
Yeah.
Dr. Baka has told that at least 7 to 8 hours sleep one should have it to avoid
Yeah.
all this type of calamity. Now, one thing is there in case of sleep apnea case, that is your subject, sir.
Yeah.
Sleep
Yes.
apnea case, the patient is of the sleep apnea, where he
Yes.
doesn't have the sound sleep. And he
Okay.
will have, how do you advise him to protect it? He
Sir,
should not have,
to be honest, yes, to be honest, coming to your question, the patient will sleep if he sleeps the most.
right.
He sleeps the
Okay.
most. He sleeps more than you or me. He
Yeah,
keeps
yeah,
sleeping. Number one, he sleeps more than 8 to 12 hours in a day. But what happens is his sleep is fragmented, and there are desaturations, which are the cause of illness in him. Right. So when a patient with sleep apnea is there, I would recommend that patient to isolate himself. Wear an N95 mask when walking outside or going to a zone. Practice namaste, which is our good Indian culture. There's no
Right.
need to hug anybody. Respect and be conveyed from a distance, right? And eat good food. Good food is good food. Enrich yourself with vitamin C. There have been studies which show vitamin D is a good immunomodulator which helps to protect you from the virus. So consume some amount of vitamin D, cod liver oil, take amla, take lemon juice, honey, warm water. Protect yourself from natural foodstuffs. Having said this, isolate yourself. Follow strict norms of social isolation. See, I have Parkinson's, which is one of the major risk factors for the disease. Okay.
Right, right,
I,
right.
yes. So I isolate myself from patients until unless absolutely necessary to see them. Right. I do not call them in a distance of less than 4 meters close to me,
Okay.
because when you talk, the saliva comes out and the micro droplets can travel a distance of 4 meters. It has influence, sir. So if I don't take care of my health, then who is responsible for me going down, sir? Me or the other people? This is a question I have to ask the viewers. You are your own boss.
True.
That's right. We're responsible for our own actions, and our responsibility now is a reaction to what can happen to others. So we really need to be take very, very big concern. I love the idea of doing this. We have a question here. I think you've been talking about it, about building the immunity, taking your
Yes,
vitamins, and of course the
yes,
natural way, organic ways are always better. You mentioned vitamin lemons. I hear this a lot. Is there some
yes.
particular reason why lemons are the popular fruit for doing this?
See, honestly speaking, lemons are the citrus fruits have a high content of vitamin C,
Okay.
which protects respiratory infections. They have also water-soluble vitamins to some extent with them. They are citrus, they are acidic fruits at the end of the day. The lemon has had a medicinal property all the while, and we all have used it. We all know it, right? So, and it's very easily and handily available in everybody's kitchen. You don't have to go out specially hunting for a lemon, right? What is handy? Use that the best. That is my first dictum. What is at hand? You use it first, right? Otherwise, if you go to say amla is the richest source of vitamin C, but who will go to find an amla in this point of time? Lemon is everywhere available, so at very
Right,
cheap
right.
price than amla. So you can use that.
And that's very common sense. That's not something that just takes a lot of effort. And you said something about not taking Advil, and I think that's very important to understand. That we got to be careful about the medications we put into our body while we're fighting a virus we don't understand. So thank you for sharing that with us. We had another question here about air systems and recycling air that people are in.
Yes, yes,
Uh,
yes.
What is your thoughts on that?
See, my thoughts on an air system is, as far as possible, avoid a central cooled AC system, because if you are having a office facility, it's better to keep your windows open nowadays, because it has been shown in studies when they did the studies using an artificial simulator, the virus particles just get washed off in the wind of air. It is that light, right? Rather than a closed air where it remains hanging in the suspension for quite some time.
Right.
And circulation also is like that, ma'am. If you use the same air, right, the amount of electricity consumed is less. If you let a fresh air in, the amount of electricity consumed is more. So if you are wanting to pay high bills, right, you let a fresh air in again and again, but at what cost? You'll end up paying more. Instead of that, just keep your windows open, let the fresh air come in. And as you've seen in nowadays, the quality of air has improved over all the places in the world, because of all people are being locked down. There's a lot of pollution just come down. The quality of air has improved across the globe.
Yes.
Why not use that for it?
There is one viewer has question it out, Samyak Jain from India. Doc Saab, how
Yes.
to improve immunity?
See, sir, the basic question to how to improve immunity is to have a good food, avoid junk food, right? Have a good home cooked food, whatever proportion you are comfortable with. Have enough amount of proteins in your food. Reduce the amount of carbohydrate and fat. That should increase your immunity. See, improving immunity is not an overnight task that you can just take a magic pill and increase it. You have to have good, healthy practices of exercise, yoga to follow it up with.
And so, Dr. Rahul, there are a lot of questions from our viewers because they are suffering from diabetes, blood pressure, chronic
Yes,
diseases, cancer, and also they can't take all these foods which you have mentioned,
yes,
like citrus.
yes,
Some
yes,
some,
yes, yes, yes.
take protein, some can't take citrus and all those things. So how they can build their immunity, and also viewers would like to know how they can check that whether they have good immunity system. What are the ways to check those immunity, whether we have it or not?
See, the one of the most fundamental ways to check is whether you have a good immunity system or no is observe yourself well. You don't have fever, you don't have
Yeah.
cold cough, which the people around have. It is indirectly an indicator of you having a very good immunity, right?
Okay.
See, if you want to do if suppose immunocompromised patients are there, right? Then there are specific blood tests like CD4 cell counts are done, lymphocyte counts are done, differential counts are done. But that is for a later stage for cancer patients who are on chemotherapy, right? There we determine the immunity by doing the blood tests. Now, how do these sort of populations protect themselves? Rather than building the immunity, I would suggest that they take all healthy food stuff, right? Healthy food stuff which is not likable by all of us. They can have a good amount of soya bean, which is a veg protein. They can have egg white, which is always permissible to them, which is also a good source of protein, and build their immunity up slowly and steadily. But most important in all I do is social distancing and hand wash. This is the most important. You do social distancing and hand wash, you keep the virus out 99% of the times of your own house.
Okay. And
And-
how do they have to isolate themselves from their, family, because people are suffering from a lot of chronic diseases and a lot
Yeah.
of other. So, and they are very prone to COVID-19.
See, rather than separating the family member who is having a chronic respiratory disease out from the family right at start, let the family and the member follow social distancing within the house. Maintain a distance of 2 meters apart from each other, right? And let that person who is having this chronic respiratory illness or chronic disease do not venture out. I'm very specific to this. Do not venture out. Because once you venture out without a proper precaution, you are subjecting yourself. You're calling harm to yourself. Then nobody else is to blame once you get it, sir.
You don't know what kind of a matter you're going to bring back into the home. And it's kind of like a horror movie. I hate comparing it to horror movies, but for the mindsets who don't understand, it's very much like a horror movie. You go out into that unknown, you don't know what you're bringing back home. We have no
Yes.
idea the origins. We're still finding out that animals can get the virus. So we have no idea the origins, what we're fighting. The best thing to do is stay home, let the doctors do their job, get the
absolutely.
contaminated. I do have a question for you. I don't think it's one of the ones that are being asked here, but ventilators have been a big topic in the medical field. And what have you seen in the use of ventilators for this particular disease? And what's your opinion on using ventilators?
Life-saving.
Great.
One word for them, life-saving. You have to use ventilators ASAP. You feel the patient is going to respiratory distress. Because when you are able to tide over the crisis, there are two types of ventilation. One, we do prophylactic ventilation when we anticipate a crisis and go ahead and do intubation and ventilation. And when the patient has CPCR and you do, that is the heart stops beating, you do the revival and you put the patient on ventilator. The chances of recovery of a patient after the patient's heart has stopped beating is much less, rather than go and preemptively intubate and ventilate the patient in respiratory distress. You tide over the crisis, you support the body with a good amount of nutrition, fluid, and medicines, you are able to get the patient out.
I'm glad to hear that. There's been such a huge controversy. We know that there are not enough ventilators in our country in some places. How has it been for your country, in your hospitals?
See, we have not yet faced a shortage of ventilators, probably because social distancing, which is a norm, which our government has promoted, has been followed well in our country. Though you hear sporadic reports here and there, 90% of the population is still indoors. So if you see the graph of people infected across the world and compared to India, we are much less. So whatever ventilators we have for now are sufficing for us. But if we do not follow the norms of the government and do our own stuff, then we will also run in shortage like you guys are running at the other end of the world.
I mean, it's just so simple. It's we say our pill right here, stay at home. That's the medication. For preventive, stay at home, wash your hands, normal hygiene, stay close to home. I mean, where I live in the country, so I'm hoping by going out into my woods, I'm not.
I would like to take this viewer question. This is very important. Can you advise the use of hydrochloroquine tablets as a preventive measure? There's one viewer who has put this question.
Yeah.
Hydroxychloroquine is only recommended for prophylaxis in healthcare workers.
Thank you.
Okay.
Because they are exposed to the virus. Please do not take this tablet at your own self. It is known to cause ECG abnormalities, which you will never pick up.
Thank you. That
So,
was a
sir, one more
question
question
because
for
we
you.
have that.
So, are the patients with asthma who are using anti-IL-5 treatment or similar
Yes,
that uses
yes.
the at higher risk basically, should they stop or modify the dosage, or what should they do? Because
No. They should continue their usual doses. The point what I want to bring to your notice here is Britain, which has the highest incidence of asthma, has come out with the finding that asthmatics have a lesser intense course of the disease. If you take your
okay,
medicines well, they are known to protect you.
okay. And sir, we had Dr. David, with us earlier this week, and
Yes.
he's treating his patients like he's treating the asthma patients because he thinks that asthma and COVID patients with respiratory problems are in a similar stage. So, what, do you agree with that, or do you know about any practice or case studies about that?
See, I'll tell you honestly, I see a lot of asthmas day in and day out. I
Yeah.
wake up with asthma, I sleep with asthma. I've yet to see my single patient of asthma going into pulmonary respiratory failure or COVID. From
Okay.
January, since the time the disease is entered in the country to now, I've had zero patients of asthma going into complications.
And sir, there is one more question regarding asthma, that people are using inhalers, and can it be become
Yes.
infected? What?
See, to be honest to you, with regard to inhalers, it is not the inhaler which gets infected, it is the canister or the spacer which the
Yeah,
people
yeah,
use as an intermediate thing. Now, where you keep the spacer is important. After cleaning the spacer, you keep it on the kitchen sink, which most of the people do in the house. So
yeah.
at night, cockroach comes and it dances over the your inhaler and goes away, making it infected and more prone for allergens. Or you keep your inhaler in a very cool, dry place. See, it's very simple. You just use lukewarm water, just dip your inhalers into it, or the spacer into it, water, shake it dry, and keep it in a dry place, cupboard at a safe place. That's it. It's required only that much to clean your inhaler, and you have to clean your so the vehicle conduit, that's the spacer, once a week. You don't have to clean it every day, provided you are the only person using the spacer. If
Okay.
you are sharing the spacers where the economy of spacers is practiced, then the mouthpiece needs to be cleaned with every single transit with alcohol swabs.
So that's
Okay.
that's
And
interesting to
also
know.
would
I
like
didn't
to.
think about that, but you could even put it
Mm.
in a Ziploc bag, right? You can put it in a little Rubbermaid container.
Yes.
It doesn't have to sit out. I mean, so we've got some questions from some other guests who are watching.
Yes.
And
So,
do you
Brenda
want to
Titlani
ask?
would like to know that can fever be the only symptom for COVID-19, or maybe there are multiple symptoms, or maybe sir, one symptom can cause you COVID-19?
See, the one symptom which is not a symptom of COVID-19, which is in her, which is saying is no cough, no cold, only fever, but a headache. Right.
Yeah.
Headache can be a sign of sinusitis, infected
Okay.
sinuses not being draining well, right? And only fever is there, right? So fever, she needs to monitor a fever and watch for signs of complications which come like breathlessness or a dry cough coming in the later course of time. And if she wants to be very 100% sure, let her speak to a doctor who can ask for a COVID swab. But mind you, this swab has to be taken 2 times, not once.
Okay.
First, day 0, and then repeat it after for 5 days time. Be absolutely be sure about it.
But sir, we also have seen that a lot of people who have negative test, in initial 7 to 10 days, and then at the
Yes.
14 days they become positive.
Yeah, that is what I told you, sir, at the start, that the nasal swab is only 66% positive sensitive. We are in a process of proposing a guideline where we include a screening CT scan test wherever feasible, or screening X-ray wherever feasible, or
Okay.
do a salivary sample, which is more better. The best is the sputum, but they hardly get a sputum, sir.
And a lot of people also having problems. While breathing and on the when the mask is on, because with the
Mhm.
mask it's difficult to breathe for a lot of people. So they have to
No.
go
I would
back to the
strongly
doctor.
not agree to you because, number one, it is where you ask what the person, what is the difficulty? Is it
Okay.
breathing in or breathing out? Where is the difficulty? 90% of the time you say, I feel uncomfortable wearing the mask. That
Yeah.
is okay because you've not worn the mask throughout your life.
Okay.
If I ask you to wear something on your face, close tight, you are not going to like it, sir.
Right.
But sir, what are the best practices to wear a mask? Is there any best practice, or which side should we wear, and how often should we change the mask and things like that? Because I think this is
Masks
a
are not
normal.
recommended for Masks are not recommended for general public. Let me be first honest and very practically tell you this fact. I've seen people wearing dragon-shaped masks, eagle-shaped masks, all sorts of mask shapes I've seen throughout the city as I move. Not required unless you are coming in contact with a COVID patient.
Okay.
Healthcare workers need masks, right? And number two, the mask is never to be touched on the outer surface. Mask has to be always removed from the inner surface out. The bands have to be broken and they have to be discarded. Number three, the shelf life of the mask. N95 mask without a valve has a shelf life of 4 to 6 hours. With a valve, the shelf life increases from 8 to 12 hours. So your mask should change. How many of us do change the mask? If your masks are not changed, then they have to be UV light sterilized or clean oxide sterilized.
Yeah.
You just cannot use the same mask again and again. You are adding to the trouble.
And are there any good breathing exercises while the COVID is there, because people
Yes,
know?
yes. They can switch off on the Astha channel and watch Baba Ramdev or any other yoga teacher. You yourself do yoga, right? You do anulom vilom like this. I do every time in the morning. I have a stationary cycle in the house, which I do cycling every day in the morning just to keep myself fit. Now, some stretches, basic exercise, every one of us can do in the house, sir. For that, you don't need any specialized gym or any equipment.
Now you can even run in place, right? So I've got a question about shields. Okay, we talk about masks all the time, and I know shields are used in some places. What are your thoughts on the shields?
See, my thoughts on the shields are number one, the shields have only to be used by those people who are coming in direct contact with the virus. Wearing a shield where you are not coming into direct contact with the virus. Suppose I wear a shield and I'm out in the society, I'm doing injustice to the equipment which I'm using. Secondly, where are the shields made? Are these shields sterile shields, or they've been just been used hand use and whatever way you are using it? This adds to the greater trouble. My point to all the viewers is use minimum equipment and necessary equipment. If you need it, you use it. If you don't need it, please don't use it. For the sake of having false security, you are adding to trouble to yourself. Because more amount of devices you wear on your body, more are the chances when you are removing them, you'll contaminate them. Your hands with them.
Exactly. And wash your hands. There you go. We go back to the number one thing: wash your hands. Yeah. It always comes back to the hands, right?
Because that is the most simple and the most effective way we keep the virus out of our doors.
Right. It's so basic, people. There are some extreme things but those extreme things, leave them to the doctors. Don't self-medicate. If you feel like you're sick, call your doctor. Stay at home, use the phone. We've got this little motto here: stay at home, use the phone, call your doctor, and let your doctor treat you. Don't self-treat. So,
I think I have a question on behalf of Max, that chess players do a lot of moves and they have to test those chess equipment while playing it. And then they, I think, do a lot of timers button in between. And I think if we continue follow this practice, how a chess player should take right precautions while playing a chess game. Dr. Rahul?
Sure. It's
yes,
true.
I didn't get your question in the first place.
Oh, it's for Max.
Max?
It's for Max.
Max will be a better person to answer as a sports guy.
Yes. So with the chess, obviously, when you're playing, face to face, it means that when you're touching the pieces and capturing the pieces, then it's very easy for the germs to spread. And I think this is why there aren't any face-to-face tournaments taking place at the moment. I remember some players actually, before the tournament were cancelled, doing this sort of elbow shake, because normally in chess you shake hands, but of course it spreads the virus. So they sort of do other things like namaste to sort of greet each other. But now all the chess is being done online, so it's sort of with the sporting events. If it's other more physical sports, then you can't really take it online. But with chess, it doesn't really harm the experience so much. So in that sense, the chess players are very lucky to still able to practice their discipline even during this crisis.
Yes, Dr. Rahul.
Yeah, I had a question to my friend in sports. Why not use a digital screen and stay at a distance of 4 meters away from each other and use a huge digital screen in your competition? and